Hey future doctors, welcome back to our channel Teddy Guides You. This is Harshita. So today the topic of interest is keratoconus, which is also called as the conical cornea. The name itself is saying kerato means cornea, conus means the cone shaped structure of the cornea. So the perfect definition is it is a progressive, bilateral, non-inflammatory corneal thinning and ectasia. So these are the important. You can see it bilaterally, which is gradual in progression, and non-inflammatory corneal thinning. Okay, it affects the central and paracentral cornea. For example, here if this is cornea, here the central part and the paracentral part of the cornea is getting affected and causing it to bulge forward. So if this is your cornea, causing it to bulge forwards, so here there is a cone shape of cornea, bulge forwards into a cone shape. Okay, and it is progressive, like starts at puberty and progress gradually. So the only important point is it is bilateral condition, non-inflammatory corneal thinning. Okay, you will see cone shaped cornea, as simple as that. Now let's discuss about the causes and pathogenesis here. The mnemonic is deep. So what is this deep? D for developmental, like it can be seen in genetic tendency in 10% of family history, and endocrine, like there will be hormonal influence which is more at puberty, so it starts at puberty. Next, E is enzyme deficiency. There is defective mucopolysaccharide and collagen synthesis, because of which it leads to keratoconus. And the last one is P. P for progressive thinning, which leads to the corneal ectasia and irregular astigmatism. Okay, the mnemonic is deep. So these are the causes and pathogenesis for this keratoconus disease. What are the clinical features here? The clinical features can also be remembered by a mnemonic 3P vision. 3 P's. P for progressive blurring of vision, because there is thinning of cornea. Photophobia. Major complaint will be glare, like when they are traveling during night time, the headlight of the vehicles will be very sharp. So glare. Polyopia, halos around lights, and vision distortion due to irregular astigmatism and corneal thinning. So these are the important clinical features. Clinical features are common. Here there is no inflammatory. So you should not write pain, discharge, itching, swelling, redness, etc. So here you have to use blurring of vision, photophobia, polyopia, etc. Now let us discuss about some of the signs. These signs are window reflex distortion, like there will be irregular light reflex on the cornea. So light reflex is a test that we do on a patient by blowing light. Okay, and by that you will see the pupil contraction. Here you will see window reflex distortion, and placido disc, in which you will see distorted concentric circles, and slit lamp, which shows central thinning. So these are the important points that you must remember. And the fourth one is retinoscopy, which shows scissor reflex due to irregular astigmatism. And ophthalmoscopy will show oil drop reflex. So if this is cornea, you will see oil drop kind of reflex. And Monson sign. Here, for example, the cornea is in cone shape. So because of this cone shape, while closing the eyelids, the eyelids will touch the cone shape of the cornea, which leads to the bulging of eyelids. So as the eyelids are trying to close the eye, they always get in contact with the bulge or the cone structure of the cornea, because of which it will leads to eyelid bulges. Okay, so these are the important points that you must remember here. Next one, diagnostic tricks. Keratometry, corneal topography, and pachymetry to know the corneal thickness. Okay, and types of keratoconus is also important. It is nipple cone, which is small and steep curvature, oval which is medium, and globus cone which is large. So these are the important points, and for diagnose and for treatment you can give them contact lens, because the contact lens will obstruct the or will get contact with the cone of the cornea so that it subside. So these are the important points that you must remember regarding keratoconus, the cornical cornea. Okay, the name itself is saying everything. Hope this video helpful. Consider subscribing to the channel Teddy Guess You for more interesting medical videos like this. This is Harshita signing off. Thank you so much.